Hi, Doc Mitch here. Now let me ask you a question. Have you ever experienced painful menstruation? This is what we call dysmenorrhea. Dysmenorrhea is more common in adolescents and young women. And the treatment usually is dependent on the type of dysmenorrhea that you have. Okay, so there are two types of dysmenorrhea, the primary and the secondary. The primary is defined as painful menstruation with no accompanying pelvic pathology, meaning walang nakitang kahit anong sakit or walang nakitang kahit anong disease entity that would actually lead to you having symptoms of dysmenorrhea. And then secondary dysmenorrhea is because of or is defined as painful menstruation because of a pelvic pathology like endometriosis, adenomyosis, myomas, and pelvic infections. So how do we treat it? Initially, for primary dysmenorrhea, what we do is pain management. So we give NSAIDs like mefenamic acid and ibuprofen to control the pain. We usually give it during the days when the dysmenorrhea actually happens. Now, we give this for 3 to 6 months. However, if within 3 to 6 months there is no improvement, then we actually do further investigation to find out if there is a secondary cause for the dysmenorrhea. Now, for the secondary type of dysmenorrhea, the treatment is usually dependent on what the cause is. If it's endometriosis, we can actually give hormonal treatment. If it's adenomyosis and myomas, dependent on the size, we can actually do medical treatment or we can do surgery. If it's a pelvic infection that is causing the dysmenorrhea, then we need to give antibiotics. Now, let me tell you this. Menstrual pain can happen from time to time, but if it becomes a regular thing of yours and it actually affects your daily activities already and requires you to take medications, then this is something that you should take seriously because it may signal something more serious that's happening inside of you. So it's best to actually seek, consult, talk to your doctor, and know what the problem is.